Sometimes parents ask me about a very sensitive subject for parents. That is, what do I do when my child reaches puberty and starts touching himself below the waist, touching his private parts? What should I do to stop that from happening? And is there a cure? Well, one, there's no cure. Number two, the best way to minimize the amount of touching oneself that an intellectually disabled child does once they reach puberty, and that's roughly around age 13, is not give them any attention when they're touching themselves while you're changing their diapers, for example, or when you're bathing them. Sometimes an infant or a toddler will just touch their genital while they're bathing or having their diaper changed. And if a parent slaps their hand at that moment, that can lead to the child who becomes an adult or an adolescent who now does it even more. Because now, if it's a male, for example, their testosterone has kicked in, so they have much more of an urge to be responsive to the brain cells that are activated for a sense of sexual gratification. Now, when the child is intellectually disabled, or the adolescent is intellectually disabled, we want to be very, very careful to not run the risk of having them reach adolescence and get to the state where they are taking their clothes off in public and then just touching themselves. So it is crucial when they're infants to pay no attention to that touching. Instead, distract the child, not distract them by taking their hand away, but by ringing a bell or shaking some rattle or doing something with your hands to distract the child from touching themselves when they're an infant or a toddler and you're doing diaper changing. If that is done, then typically you're not going to have a problem once they become an adolescent. Now, I have several patients who are over 13 who do have a problem with masturbation. And so there is medication that we can use to decrease the motivation to masturbate and decrease the ability to get an erection. However, there's no cure. The most important factor is to understand as a parent when your child is an infant and a toddler and experiments with touching themselves, never, 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 abadan, never slap them for touching themselves as an infant or a toddler, or this is going to lead to a problem when they grow older. Now, let's just imagine your child has not gotten to the point where he takes his clothes off in the house and then masturbates in public. But he just, in his room by himself, lays in bed and lets the sheets and the blanket rub against him. Then it can be helpful if the parent conditions the child to sleep on his belly so that there's less preoccupation with wanting to touch himself. Thank you for listening.
أنا شايف جمال. يلا أنا خلصت القصة. باح باح باح. أنا شايف جمال. أنا شايف جمال. يلا أنا حقلب القصة. أنا خلصت قراءة القصة. أنا خلصت. أنا لما بخلص بقول أنا خلصت. إنتي